Thank you so much for joining us, Mr. Kiani. Explain to me what your device is and how it works.
Our device is pulse oximeter technology that works even when there's patient movement and low perfusion. And we have made it into a wearable device that attaches to the wrist like a watch, and the sensor goes to the digit, and it can accurately measure continuously for 4 days at a time the oxygen saturation, pulse rate, respiration rate, perfusion, and PVI. And that information through Bluetooth is sent to your smartphone or smart tablet, and then from the smartphone or smart tablet through the cloud, it can be sent over to a central monitor, maybe at a hospital or even service that we provide, to continuously monitor the patients, both for COVID-19 and other issues that relate to respiratory problems.
And give us a sense of how much it's deployed right now. How much is that device being used for COVID-19 patients, either in the hospital or at home?
Well, Masimo has been around for 31 years. I founded the company, and we are the leading pulse oximeter company in the world. Over 200 million patients are monitored with our technology every year. 9 out of the 10 top hospitals in U.S. News primarily use our technology. And we have seen an amazing surge of demand for our products in the traditional settings in hospitals. And then also they're using this device in a couple of different ways. In hospitals to shield the patient from the care providers as much as possible. As you know, every time a care provider has to go to the room to watch the patient or watch the monitor, they require PPE, and they're also putting themselves at risk. So some hospitals are using this tetherless, wireless pulse oximeter technology to put the patient in the room and have the monitoring done outside the room. In addition, we've started a pilot program at University Hospital with Dr. Peter Pronovost and his colleagues, and at St. Luke's with Dr. Carmona. And what they're doing, they're sending patients that meet certain criteria for COVID-19 and other respiratory conditions to home and monitoring them remotely. And if they get to a situation, let's say their oxygen is 93% or lower for more than 5 minutes, these patients then are brought in. And right now we're wrapping up that pilot, hopefully with the successful completion of that pilot, which 2 other hospitals are now taking part in. We're going to do a full market release of this product we call Masimo Safety Net, hopefully this weekend.
So give us a sense about your basic product. It sounds like there should be a lot of demand. Are you having any trouble keeping up with that demand? I mean, what are sales like right now?
Well, we actually had pre-announced our numbers because it was so much more than we had projected, and we just did that April 1st because we knew our suppliers knew what's happening, some of our people in manufacturing, our customers knew what was happening, and we're afraid the general public didn't know, so we did do that, and the demand has been tremendous, and it has not stopped. And we're holding up. We're keeping up with it. Fortunately, we began worrying about this COVID-19 potentially becoming a problem for us to manufacture, so we began modularizing our manufacturing, setting up other sites. We now have 3 sites that are manufacturing our sensors. We have multiple sites manufacturing our instruments, and so far, thank God, we don't have any problems in any of our factories, so we are able to keep up, and we're also building up inventory so that if we do have any hiccups, we can go through the inventory while we try to bring up another manufacturing site up